Now, despite abortion being decriminalised in New South Wales since 2019, many women cannot readily access the healthcare they need, especially in regional areas of the state. It means a woman has to travel hundreds of kilometres to seek an abortion. Recently, a bill was introduced by Greens Upper House member Dr. Amanda Cohn, who seeks to fill the so-called abortion deserts. I spoke to her from New South Wales Parliament in Sydney. Well, Dr. Cohn, thank you so much for joining us. You have been in the limelight quite recently because you've highlighted a very serious issue that has developed across many parts of regional New South Wales, especially areas like the New England Northwest, about abortion deserts. And we know sometimes when people are discussing abortion healthcare or anything like that, it can be a very touchy subject depending on your perspectives. At the moment, what is first the current abortion laws in New South Wales?
So abortion was decriminalised in New South Wales in 2019, 5 years ago. A lot of people are surprised that that was so recent. So it's legislated as a health procedure, as it should be. But since 2019, there hasn't actually been a lot of work to make sure that services are actually available. And while abortion was still in the Crimes Act, I lived down in Albury-Wodonga and I was working as a GP just across the border in Victoria, providing holistic reproductive health care that includes abortion. And we were seeing people travelling hundreds of kilometres across Western New South Wales, coming across into Victoria to access abortion. 5 years later, the law has changed. Abortion is legal in New South Wales, but it's still too hard to access, and we're still seeing people having to travel hundreds of kilometres or pay hundreds or even thousands of dollars out of pocket to access something that can and should be provided in their own community.
And you know, of course, that out here in the New England Northwest, we have some of the most remote communities in the state, and some places it's even a lot closer to get procedures done in another state completely. If you're further around like Inverell, Moree, you've got a better chance of going to Brisbane instead of going to Sydney. And sometimes you would expect maybe to get a procedure if necessary or chosen in at least one of our major regional hospitals, but we don't necessarily have that. What's the situation that we've got here?
Yeah, absolutely. So from the Hunter, New England, many people are having to travel quite a long way, away from their regular doctor, away from their support networks and their family and friends, at a time that can be quite difficult, needing time off work. This is relatively straightforward healthcare. The medical abortion tablet that can be prescribed up to 9 weeks should be available in small communities from the local GP. Surgical abortion in the first trimester is something that most regional base hospitals have the technical capability and the staffing to do. And so people shouldn't be having to travel this far.
And can you explain the difference between a medical and a surgical abortion?
No problem. A medical abortion is essentially an induced miscarriage from the prescription of medication, and that's currently legal in Australia up to 9 weeks of a pregnancy. It can be very safely provided by GPs. It can be very safely provided in rural areas, and the TGA actually allows endorsed midwives and nurse practitioners to prescribe that medication too, and that's what's happening in Queensland and the ACT, and it's what I think should be happening here in New South Wales to get that access closer to home. A surgical abortion is a minor medical procedure, depending on how far progressed a pregnancy is. So in the first trimester, it's essentially the same as a procedure called a DNC, or the treatment you'd have after a miscarriage. It does get more complicated later in pregnancy, but we know that the vast majority of abortion happens in that first trimester, and it's those procedures where the rural-based hospitals actually already have the staffing, already have the technical capability to provide this care. They really should be providing that in the country.
I find it very difficult to understand what the reasoning is for any state government of New South Wales not to provide the resources, staff and personnel and the information out there ever since abortion was decriminalised in 2019. We're now in 2025. You would have thought that by now, even with that legislation with being in place as a framework, there would have been all those procedures ready for the local health districts to make the access to abortion healthcare readily available, but it looks like they just seem to have completely either not bothered or just don't understand what the repercussions were.
Yeah, and that law change in 2019 just wasn't followed up with the actual funding for provision of services. Most people expect that most public hospitals would provide abortion care. There's been really good representative polling of residents of New South Wales. 68% of residents of New South Wales think that public hospitals should be providing abortion care. And it's also too hard to even find out information from where to go. I've heard from so many people that they've had to ring around to actually find out information about where to go. Whereas in states like Victoria, there's a really fantastic service called 1-800 My Options, which is both a telephone number and a website that provides really clear information about what services are provided where. And for something like abortion that's really time sensitive, it gets more complicated the further along a pregnancy is. It's actually really important that people can not just get that care closer to home, but easily access information about what's available and where they need to go.
And you also mentioned, of course, the cost, even to get a medical abortion, that can still cost hundreds of dollars for the medication, as well as the travel time, and also the mental and physical distress that a woman would be placed into, because she is going to make a choice that, you know, she knows is very difficult for herself.
Look, it's a deeply personal decision, and I think the role of the health system is really to support people to exercise that choice as safely as possible, as close to home and as reasonably possible. And ideally, that involves people's regular health professionals. You know, for people who are lucky enough to be able to see a GP that they know and trust, that's the best place to be accessing this kind of care.
And Dr. Cohn, have you faced threats or intimidation because you have been in the health system where well, of course you are pro-choice, but you've also, as a doctor, been assisting women with abortions? Because we know how politically motivated and sensitive this whole thing is, but for the doctors themselves, we've seen, of course, tragically, some people being threatened or hurt physically or even murdered.
Before 2019, there was a significant problem in New South Wales, including Albury, where anti-abortion activists would protest outside of clinics and actually intimidate and harass patients and staff. Since 2019, we've got safe access zones around reproductive health clinics in New South Wales, so that doesn't happen anymore. There are people protesting about this issue on a regular basis outside Parliament in Sydney, and that's the right place for people to express those political views. And I'm really grateful that they're now protesting to politicians rather than the health workers and the patients who deserve privacy.
Now, with the bill that you've introduced last month, what is the main priority for that, and how far has it progressed in state parliament?
So I've tabled my bill in the upper house of the state parliament, and hopefully it will be debated in the coming weeks and coming months. The two most significant changes that the bill proposes are placing a duty on the Health Minister and the Secretary of New South Wales Health to actually make sure that abortion is accessible throughout the state a reasonable distance from where people live. And also allowing endorsed midwives and nurse practitioners to prescribe the medical abortion tablet, which, as I've explained, it's legal in Australia up to 9 weeks gestation. The TGA allows endorsed midwives and nurse practitioners to prescribe it, but in New South Wales, it's still limited to only doctors. So making that expansion will really improve access, particularly in rural and remote communities. The bill also proposes to remove, there's some really onerous, bureaucratic, mandatory reporting requirements about abortion that are just really unnecessary. And it also proposes that for health professionals who have a conscientious objection, who choose not to provide abortion, I think that's an important right for those individuals, but the bill proposes a requirement that they actually refer someone on to be able to access that care elsewhere, rather than sending patients back to the drawing board to have to work out where to go themselves.
And what's been the response so far from your fellow parliamentarians as well as the general public?
When I talk to members of the general public about this, many people are shocked that this isn't already the case. People reasonably expect that you can access abortion in a regional public hospital, and they're shocked to find out it's not already happening. And there was some really impressive investigative journalism last year that found that only 3 out of the 220 public hospitals in New South Wales are consistently providing abortion and making it publicly known that they provide abortion. People are shocked to hear that, and they think that it's already happening. So there really is a lot of support for change. Particularly, there were some really heart-wrenching stories in the media last year from people who were turned away from public hospitals in Orange and Queanbeyan, which has really provided a lot of momentum for change. I think also when you look at what's happened in the United States and closer to home in Queensland and South Australia, where there is a real push to actually take reproductive rights backwards, it's a really important time to actually embed access to reproductive health care in the public health system and actually strengthen our laws so that this can't be turned backwards in New South Wales.
And just briefly, Dr. Cohn, I know you also had a lot of concerns regarding the state of the New South Wales health system, particularly with the big staff shortages we've had in regional and rural areas. We've had the nurses' strikes that's happened last year. We know that several hospitals have been on bypass. We have Tamworth Hospital at a 40% occupancy rate. Weewar Hospital isn't operating 24/7. And this situation to try and get more staff, specialists, GPs to these regional areas has been very difficult because many people have been reluctant to come up to these areas. And as it's been stated, the New South Wales nurses are some of the lowest paid nurses in the country at the moment. How are you finding the health?
The New South Wales government absolutely needs to pay nurses, midwives, and public hospital doctors at least what they don't in other states. This is really straightforward, especially in communities like New England Northwest that are quite close to the Queensland border, like my own community of Albury, which is close to the Victorian border. Why would health professionals continue to work in the public system in New South Wales when they can make 20 or 30% more across the border? So for nurses, they make 18% more in Queensland. For a psychiatrist, they can make 30% more in other states. The Nurses and Midwives Association have been campaigning on this issue for a long time, and the government just hasn't come to the table to offer them a meaningful pay rise. We're going to continue to see these kinds of staff shortages until the state government actually just pays healthcare workers what they deserve. And, you know, for those issues you've raised, like maternity services at Tamworth, like Weewar Hospital, to actually get staff working in these areas in the public system, we have to pay them what they're worth.